Hello, my name is Olivia Matsis, and this is my pocket guide video for NU665. I made my pocket guide in a binder, and all of the entries are in sheet protectors and have all of these colorful tabs on them. I have 40 entries in my pocket guide, all from topics that we learned this semester. So this is the table of contents. And then the first entry is just the different types of headaches, primary versus secondary headaches. And then I have a section on migraine headaches, all about the different types of migraine headaches, chronic migraines, migraines with aura, and the treatment for them. And then I had a section on tension headaches and how to treat them, the signs and symptoms. And then we moved to cluster headaches, the symptoms, and who gets cluster headaches and how to treat them as well. I also have a section on temporal arteritis, and the red flags for headaches. And then the next section is on stroke, so it's on ischemic stroke and hemorrhagic strokes, how to diagnose them, and what the treatment is for both of those. And then we move on to perimenopause. So I just have all these bullets about the different symptoms of perimenopause, at what point in life does it occur, and how to treat the symptoms. And then similarly, I have a section on menopause with the treatment and the symptoms. I also included a section on HRT. And then the next section is on osteoporosis. So the signs and symptoms, the diagnostics, and the treatment for osteoporosis and osteopenia. And then the next section is on autism spectrum disorder. So I included a table here about the early signs and symptoms of autism spectrum disorder, and the DSM-5 diagnostic criteria. And then I made this table on just the different levels of impairment for kids with ASD. Then I have a section on ADHD, so the diagnostic criteria, the symptoms of inattention, and the symptoms of hyperactivity and impulsivity. And then I included the treatment, the different medications and behavioral treatments. And then the next section, I included this table from Up to Date. It's just the different type of stimulant medications to treat ADHD. And it goes with the pictures. And then the next section is on pediatric seizures and epilepsy. So the different kinds of seizures, generalized versus focal, and the symptoms of those, and then the different drugs to treat seizures. I also included a section on febrile seizures. And then this is a table just differentiating the different kinds of seizures that I got from Up to Date. And then we move into the orthopedic section of my pocket guide. So I broke it up by the different body parts. So this is on upper extremity shoulder injuries. And then I highlighted the different tests that you do for each type of injury. And then the next section is on elbow injury, so same thing. And then I highlighted all of the different tests for the elbows. And then I have upper extremity hand and wrist injuries. And then lower extremity hip injuries is the next section, same with the diagnostics and how to treat each one and the different tests that you do. And then this is on lower extremity knee injuries, so the diagnostics, the symptoms, and how to treat. And then lower extremity foot and ankle injuries. And then the next section is I made this table on the different types of breast cancer. So it has ductal carcinoma in situ, a lobular, invasive lobular, and invasive ductal, and then it says if it's invasive or not invasive, and then the characteristics of each. And then I also made this table that has the different stages of breast cancer and explains the different stages, 1 through 4. And then this section is on the treatment of breast cancer. The next section is on infertility, so primary versus secondary infertility, male infertility, female infertility, the causes of each, and how to treat those. And then I had just this little section on the different screening tools for substance use disorders, so just names which one is used for which. And then I did include an audit screen in here just so I had that available for me. And then my next section is on anxiety. So the diagnostic criteria of anxiety and how you treat it. And then the same for depression. And then I put a PHQ-9 in here just so I had an example of that to reference. I also put a GAD-7. And then the next section is on eating disorders. So I made this table of the 3 types of eating disorders. It includes the clinical presentation, medical complications from eating disorders, and the treatment and the treatment goals for each. And then I got this little table from Up to Date. It's the medical complications of anorexia nervosa, because I felt like that was really important. And then I also included 2 more tables from Up to Date. This one is the diagnostic criteria for bulimia, and then this is the diagnostic criteria for anorexia nervosa. And the next section is on advanced care planning. It just includes what advanced care planning is, when you bring it up, all that good stuff. And then advanced directives, what a power of attorney is, what a healthcare proxy is, what a living will is. And then I did include a MOLST form just so I had that to reference. And then the next section is on unintentional weight loss, so the signs and symptoms, what to do about that when you suspect that there's unintentional weight loss in a patient. And then I included this algorithm from Up to Date. It's just the approach to unintentional weight loss treatment. And then my last section is on obesity, so identifying risk, who's at high risk, low risk, moderate risk, etc. And then the treatment of obesity, the different options, surgical treatment, medications. And then I just included this algorithm from Up to Date as well on how to treat overweight and obesity. And that's it. That's my pocket guide.